All right. Who's first? Me? I can just say. I'll do it.
Let me say hi first.
What the
Oh, okay. I thought you were waiting on us.
No, I was
over
waiting.
this show. Hijack.
It's my show, motherfuckers. All right, we're taking over.
I'm the captain now.
Okay.
Look at me.
This is going.
We've had enough of men running the show. Okay.
This is going well already. Welcome to yet another episode. Welcome to yet another episode of WhickTV, a cross-ideological space where we come together to talk about issues political and cultural, from the silly to the serious. We got a show for you tonight, gang. We're doing it a little earlier than I normally do, so thank you for coming in, right? Thank you for showing up and wicking out with us, and hopefully it'll be an interesting discussion. We're going to be talking about a recent discourse that I saw on my Twitter timeline that I researched into a little bit, and it was a question that I have, and if I have this question, I'm sure others do as well. The question is gender dysphoria real? And the reason we're asking this question today is because Philosophy 2 put out a video about a month ago now. I'm not sure the timeline here.
Like 2-3 months ago.
Yeah,
this is not recent.
It was
a Twitter discourse standard that was 5 years ago.
Wrote an article back in June of 2022, I think, was when she first kind of brought this up.
And the thing that sort of triggered the discourse recently was her tweet in response to an article or a post, and saying, basically reiterating the same point that she made in her video, but a little bit more tersely. And so that triggered a whole bunch of discourse as a result. Indeed. And so in the video, which I watched, she talks about how it is a category error. And we're going to get into that and what that means. But I guess to start us off, before we do the introductions and openings, I want, for my audience, if someone here could just briefly define gender dysphoria, right?
Oh boy.
Anyone want to take a stab at it? Sure. It is a collection of feelings related to gender incongruence, meaning that the way one understands one's own gender is incongruent with the way that it is reflected in the world, or the way that their body manifests that gender, or those traits, so the sexual traits related to that. So it has many different possible symptoms to it. Oftentimes when someone is diagnosed with gender dysphoria, they tend to manifest a specific subset of them very strongly, and those can be things like anxiety, depression, confusion as to what they're seeing in the mirror, fear of what they see in the mirror, etc., things like that. So if
we want to get super clinical about this, I'm just trying to remember the DSM off the top of my head. So it's the feeling of incongruence that your gender does not match your identity of yourself for a period of more than 3 months, if I remember correctly. That those feelings are not related to a sense of advantage that the other sex might have. What are some of the others? For adults, Zonia, do you remember offhand? But it's a clinical thing, and it's not immediate. It's something that's been persisting for a very long time, and it has the direct wish to live in the role of the opposite gender.
Yeah, and there are things that are... There's also other similar definitions that are slightly different, depending on the ICD, for instance, has a slightly different definition that includes many of the same things, but has different requirements. I think it's 3 months or greater for one, and the DSM is
I feel like we're getting real bogged down. It's pretty simple. There are 2 definitions of gender dysphoria. One is colloquially, socially, the sad feeling that trans people feel around their gender. And that's how they communicate. I'm feeling shit about my gender. And then there's the clinical definition, which has a whole bunch of diagnostic criteria attached to it, which are probably some of the things that we'll get into later. And the one that I would like to be discussed tonight mostly, okay, is the clinical definition, because we're not really I don't think anybody is saying that like trans people can't use the word dysphoria to say I feel bad about my gender today. Maybe at some point in the far future we might move away from that because of the connotations it has medically. But right now, that's not really the discussion that's happening.
Okay, and speaking of, this is a question, right? It in the video Philosophy Tube put out, she explores why this is a problem when it comes to the British healthcare system, right?
Right.
And she explains how it is used to gatekeep, that in order to get gender affirming care, you required a diagnosis, as I understand it.
Yeah.
And I might be messing up the details, so forgive me on that. But yeah, that's what we're going to discuss today. Like, gender dysphoria, is it real? Should it be something that requires a diagnosis to receive gender affirming care? How should we approach these things? What is the best way forward? And we're going to talk about that. It should be an interesting discussion, but I want to, now that we've kind of gotten kind of a pretty good foundation to start from, we could just get into opening statements and kind of get into it. And we'll start with the lovely Brianna Wu. Go ahead.
Awesome. My name is Brianna Wu. I'm a Politico. I'm an aspiring cat tuber after meeting you today. So I'm really looking forward to that phase of my career coming up next. I think there is I don't want to say generation gap, but there is a real lack of historical knowledge and appreciation with younger trans people about how we got to this moment. And I think, very generally speaking, many younger trans people don't appreciate the fact that the Benjamins, which became the WPATH later, really standardized healthcare treatment for transgender people, right? So by having like this set of things that you had to do to transition, all of them very reasonable, right? Like go to a therapist with at least a master's degree for 3 months before getting a prescription for HRT, and then before getting, bottom surgery, basically getting 2 letters from specialists to make sure that everything you're doing is correct. I think what has, because you have this huge influx of younger people into the community, I think there's a real lack of appreciation that these standards both make doctors comfortable with providing care, and very important in the United States, it makes insurance companies willing to pay for care. So I think that there are some very legitimate criticisms about access to care and gatekeeping and education by providers. They're all 100% fair, and I agree with that. But I think what we have here is a discussion where a lot of younger people just want to throw the entire system out and move to this libertarian utopia where you're going to be your own doctor with HRT. And I would posit that that is a tremendously dangerous thing to move to, that's going to leave a lot of transgender people who disproportionately experience poverty in a place where they're completely unable to afford any kind of care whatsoever.
Okay. Well, thank you for that, and I'm sure we'll get into it in the open. Vivian, go ahead.
That was a lot. How am I supposed to do an intro? I not just run straight into the discussion after all of that.
Well, if you want, we can do Zonia first, and then you can kind of just go. You want to do it that way? We can. I'm cool with it.
You know what? Yeah, sure.
Okay.
Go for it, Zonia. Let's hear your shit as well. I'll try and get some fucking notes.
What's Zonia got?
Yeah, so I don't have a lot of disagreement with Wu's opening on this. So, but the thing that I see, so overall, what we have are most people are seeking treatment, medical treatment for their gender dysphoria or the feeling that they're having with regard to their gender incongruence. And in order for the way that our Western medicine works is we things are treated, right? So there's some sort of malady that is being treated, and there has to be some kind of diagnosis around that malady. And so that is where gender dysphoria comes into play, is to allow for a course of treatment available for people who struggle with strong enough feelings of gender incongruence to want to have to deal with it medically, to where they would transition and deal with, taking medications for HRT or getting surgeries, etc. And so oftentimes there's some haziness around defining that thing that needs to be treated, as with a lot of things. Another example of that would also be something like irritable bowel syndrome is another kind of one of those things where it's like there's a cluster of generally occurring symptoms, not always the same ones, but generally these symptoms, and they tend to affect people in this way, and therefore it's something that they can diagnose, which allows them to go forward with a path of treatment. And so it is an imperfect system, but it is a system based around treatment of maladies. And so that is how our Western medicine system operates. That's how the NHS operates. That's how US medicine operates. And so therefore, I think gender dysphoria has a very important role to play in that. And we already have existing systems that you could go outside of the system if you wanted to, if we didn't care about gender dysphoria, where you could approach it from a cosmetic angle. And then you could, if you had the funds to do so, you could approach it through cosmetic surgery, or you could go to other countries where they don't have the same kind of Western medicine regulations, which used to be the common thing back in the day. It was like flying out to Thailand to get these surgeries done and such. And you could operate that way, where you don't actually have to go through the stages of doctors giving diagnoses and signing off on procedures. But then there's a bigger issue to kind of talk about. What it comes down to then is, is the gatekeeping sort of the thing that is leading people to, like, for instance, leading someone like Abigail Thorne to want to say gender dysphoria is sort of a problem. Is this something we need to get rid of to make it easier for people to go and establish kind of the body that they want and the treatment that they need? And then that's a separate question. But for now, we have gender dysphoria as a diagnosis to allow for the treatment of the malady that is gender dysphoria.
Okay.
And so that is my opener.
Okay, well, Vivian, let's go.
Yeah, sure.
Go for it.
Yeah, I didn't really take any notes from Zonia because I don't. Not. Shit, man. That sounds rude. I don't think she added like a significant amount to what Brianna Wu said. Not in a rude way, but just I don't think there was anything like super extra there that I needed to like address. But it seems like you're both coming from like a very similar position, right? If you'd have gone first, maybe I'd have said the same about Brianna. Hi everybody, I'm Vivian Wolf. Nice to meet you. Anyway, first off, I do find it kind of patronizing, the idea that it's just younger people. I'm 33, 34 or something. I don't think that the depathologization movement is something that's entirely restricted to younger people. Indeed, there were like protests in the 80s, in the 90s, right, in the early 2000s, culminating in the ICD's depathologization. I'm going to have to fucking say that so many times tonight. I need to get my mouth around it. Depathologization in 2013, if I remember right. So this isn't a movement of young people arguing for a libertarian utopia. I don't particularly think. I also would disagree that like some of these requirements are reasonable. You mentioned very reasonable requirements, like requiring 2 separate diagnoses before any kind of surgery, and requiring, what was the first one before going on HRT? 3 months. 3 months of seeing a particular psychiatrist before. And I think with the way that that transgender identities are pathologized with this diagnosis of dysphoria, that these requirements place an undue strain and honestly an undue violation of people's like autonomy and freedom. I think people have argued that, obviously it goes against the Yogyakarta principles, but also Article 8 of the UN Human Rights Declaration as well. and that it's really only trans people who have to go through this like level of extensive analysis and investigation before they're allowed to exercise any kind of autonomy over their own bodies. And then, so that's addressing basically what you said. And then additional problems of pathologization come with the discrimination that trans people face in societies in general, and the requirements for them to, one, access healthcare, and two, live their lives in society. So depending on the nation, obviously, there are different requirements, but they have ranged anywhere from sterilization to have your gender legally recognized to all kinds of stuff, right? And finally, I would say that this view that in order to receive treatment, in order to receive trans-related healthcare, one has to prove that they have gender dysphoria, disenfranchises or excludes many people who don't experience symptoms that would meet this definition, right? People who still have some measurable distress around their gender, but that it doesn't meet the criteria of gender dysphoria. And those people, you know, under a strict system where healthcare is entirely gatekept by these diagnoses, would reduce access for those people or eliminate it entirely. And I think that that's a horrible outcome.
Okay, well, gang, let's get into it.
So can I counter just a couple of things there? It's very easy to think of multiple medical procedures that do have requirements for them. Bariatric surgery just immediately comes to mind. Like, many physicians won't do bariatric surgery, stomach stapling procedure on you, unless you can prove that you can lose some weight and reduce the amount that you intake, because it can very well kill you after the fact. They're not doing that to gatekeep or to hurt people. It's because the procedure itself has some contraindications that you need to think about here. So you said something there, that these requirements here can keep out some people that don't meet those requirements. Zonia, I don't want to speak for you, but I assume you also think that we need massively more research into this more current population of trans people to update those standards, right? To figure out what's what and update those procedures there. So, so if I agree with you that that's something we need to think about, but the answer there is more funding, more research, doctors thinking through this. There's a real danger that I see online with people encouraging other people to take HRT like it's Tic Tacs. And it's just not. I mean, anti-androgens can have terrible consequences for your blood pressure, right? They can make you sterile. As far as the HRT, it is doing changes to your body. Like, you're going to develop breasts if you are a female to male trans person. It's going to have a lot of permanent changes there as well. I'm 100% enthusiastically, strongly for more healthcare access. But I think slowing down, making sure the diagnosis is right for people, having them talk through therapy with people for a few months, that doesn't strike me as very onerous, particularly because you can start socially transitioning anytime you want. We're talking about access to HRT. So I really think if you look at these guidelines here, it's not, hold on, I'm going to finish what I'm saying and then you can go. I think if you look at these guidelines, generally speaking, there are doctors out there and there are healthcare systems. They're looking to protect themselves and they're not trans affirming. I think everyone here would agree with that. But I think this system at its best is thinking about the patients first and foremost and wants to work with them to get them to the right outcomes.
Vivian, go ahead. You had some things.
Yeah, I mean, broadly I disagree. I think it's because Jesus. there's so much to address there. I mean, that's why I tried to make a clarifying point in the middle. I wasn't trying to interrupt you. I just thought it was prudent to mention that we're not just talking about adults, we're also talking about children, right? And especially children's access to puberty blockers is an extremely time sensitive issue. Also, that I think that most people, but for a few outliers who engage on a program of like DIY HRT, are doing a significant amount of research. One, because they have to be able to even get hold of the drugs, and two, they're going to know, right, that these irreversible changes that you're talking about are going to happen to them. I'm not for uninformed consent. I'm for informed consent, right? And I think that the system should be set up in such a way that people are informed about what these drugs are going to do, etc., so that they can make the right decisions for themselves.
Can I ask you? Zonia first. Zonia, go ahead.
Yeah, so with medical practitioners, though, they have an obligation to ensure that whatever treatment that they are providing for their patients, it is something that is, first of all, necessary, and secondly, is not too aggressive or inappropriate based on their particular conditions. And so there are a lot of regulations in place. Practitioners have to worry constantly about malpractice suits. They are constantly reviewed for whether or not they're staying in line with their ethics and within line with their board certification. So that requires a lot of additional gatekeeping on top that's outside of even just being trans. When we talk like medical gatekeeping, we're talking about trying to ensure that they are minimizing the risk and doing things that aren't unnecessary, or not doing things based on certain biases like for profit, etc. So those put in regulations and standards that cause that to be sort of gate kept, right? And so yes, there is going to be some level of gatekeeping that makes, for some people who are trying to get treatment, it may be harder for them, or it may require more time, or jumping through some more hoops or something, and that sucks.
This is precisely where I think one of the major divides in this particular conversation comes in. Something I wanted to mention earlier, but there's just so many points being rapid fired at me that it's difficult to address all of them. Is that divide between the United States and the United Kingdom? Now, in the United States, and you have to remember that, you know, the person who at least set off the discourse in this sphere, this discourse has been ongoing for decades, as I said earlier, but at least set off the discourse in this sphere. They are from the UK, and they are coming from like the perspective of somebody who lives in the United Kingdom and deals with the medical system in the United Kingdom. And here, I don't think that you can reasonably argue that the gatekeeping that exists, right, and the lack of access that exists here in the United Kingdom exists purely for the sole concern of the well-being of the patients. If indeed it does, then that is a concern that is based on like false ideas that like being trans is far more rare than it actually is, or something.
Well, there are several concerns being addressed with it, right? So it's not just the patient; it's the doctors, it's the establishment, etc. Right?
I understand that, but none of these things amount to what in some cases can be upwards of a 20-year fucking waiting list. Right? For many people trying to access trans healthcare in the United Kingdom today, publicly, on the public healthcare system, that healthcare might as well not exist.
Sure.
It functionally does not. They have no access to it. So that level of gatekeeping is where is the perspective that myself and philosophy to 𝕵𝖎𝖙 both kind of share, right? We've experienced what this gatekeeping does at the highest possible level, basically, with regards to access to healthcare. It makes it inaccessible.
Sure, and I really want to be clear, like, can we just to really put this to bed here, Zonia, I don't want to speak for you. All of us on this call here strongly, very, very strongly agree that the UK and the US is really failing trans people when it comes to access to healthcare. Zonia, you agree with that, don't you?
Yeah, there's some exceptions. Like in California, it's a lot easier than a lot of other states, but still, yeah, collectively, overall, yes, absolutely failing.
So hold on. I'm going to finish what I'm saying. So, like, please, like, I hear your point. I agree with it 1,000%. But just please don't paint me as someone that doesn't understand that is a major factor. Let me tell you a super quick story. Here in Boston, Fenway Healthcare is the gold standard, or at least it used to be, for LGBT healthcare. in Boston. It was one of the best programs in the entire country. It is falling apart right now. Before I donated to our mayor, Mayor Wu, I called her on the phone and tried to make very sure she would have a commitment to fully funding Fenway healthcare. And just because politics and other things are in the way right now, it's very difficult. So Massachusetts is failing this as well. I'm 100% in agreement with you on that. Where I think we divulge in our perspectives here is this. I think generally speaking, you're advocating a libertarian, patient knows best, does their own research, patient acts as their own doctor, and can go out and get whatever HRT that they want and get their own. Well, many in the trans community are. And I think, I have to think about this problem in terms of systems, right? What is the system that I want to move towards? I'm a political professional. I very often will call up candidates and be like, what is your position on trans issues? Do you support this? Will you vote for this bill? Do you support this policy? And depending on what they say, I write them a check or I don't write them a check. I have to think about this in terms of legislation. And I think some of this libertarian move towards do-it-yourself healthcare is just not, A, I can't sell it, and B, I don't think it's going to be better for the patient's best interest.
Well, I want to ask, right? And I'm asking you, Vivian, so you have a chance to answer. Is that your position here? Is that your position that you want excuse me for the analogy here, but do you think that trans healthcare should be treated as more of a customer basis or of a patient basis? So what I mean by that is customer basis is I want this, I'm willing to pay for it, or the insurance is willing to pay for it, give me this. Or a patient, where a patient kind of lens would be like, doctor, I'm feeling this, can you prescribe me this? I think I need this. And then the doctor makes that decision based on his profession or his or her professional opinion. What's your stance here, Vivian? So we can go forward from there.
Yeah. So Brianna asked me not to paint her as somebody that believes certain things. I wasn't. I was merely addressing what I think a lot of the fucking clash on Twitter and shit was over this particular discourse, right? I think partially it's the divide between America and the United Kingdom. A lot of Americans don't have that perspective. Partially, I think it's because people understand the word dysphoria to mean the bad feeling I get around my gender. And when Philosophy Tube says that it's bullshit, they're like, oh, they're saying that I don't have this bad feeling around my gender. And that's not what's being said at all. So I think there's a lot of misunderstandings that I just want to correct in general as I'm speaking. So I'm not trying to portray you in a particular way. I'm not just talking to you. I'm talking to you and the audience and you know what I mean.
I appreciate that.
And just to the general issue. So as for my proposal, I'm not sure it's super important to this discussion the eventual system that I would like to see. Right, personally, I would like to see an informed consent system, right, wherein somebody presents to a particular clinic, they can be somewhat screened by people so that they can be it can be worked out whether or not they are able to consent, right? Maybe they're having some kind of fucking paranoid delusions or something like that, right? Maybe they're not completely in their right mind and they're not in the place where they can give reasonable consent to these procedures and so on. Also to make sure that they're informed. Also, the things that Brianna Wu was talking about earlier, things like blood pressure and so on, hormone levels need to be regularly checked to make sure that the drugs are going to do what you want them to do, because if they're too low or you're not responding to the anti-androgens, etc., then you might not get the effects that you want. And to make sure that you have enough hormones in general in your body, because you need some, right? Because otherwise your bone health deteriorates, you end up with osteoporosis. That's why trans women regularly have to be checked for that. So blood tests and ongoing monitoring of somebody who's undergoing HRT is something that's very important. I'm not advocating for a fucking straight up bathtub HRT thing. And frankly, I don't think that the vast majority of people who do this kind of stuff are either. Like, maybe you get the occasional, like, people who describe themselves as, like, biohackers who want to operate completely independently of the medical system. But broadly, people are doing this out of a sense of desperation, i.e. the DIY HRT is the accessible option, and the other option is either, you know, inaccessible to them or has so many barriers that the DIY HRT option is simply easier for them. And that they don't feel that they can bear the weight for something else, right? Especially in the UK here, right? Huge waits. People do DIY HRT because they don't want to be waiting. You know, I said some waits were upwards of 20 plus years. I think it's very... you're not going to be waiting less than 5 years at this point, right?
Well, I guess maybe I could be a little more clear with my question, right? Maybe I could be a little more clear with my question. Do you think there's any gatekeeping other than assuming they're not having psychotic delusions, but any kind of check to see if they actually have what they want treatment for? Like, so if they actually have some sort of gender incongruence or gender feeling of this.
So if somebody wants to change certain gendered aspects of their body, right, then they're clearly displeased with how their body is currently, right? And they want to change it in that fashion. That to me speaks of, like, that is the condition, right? That is gender incongruent.
Should that be provided through the medical system or through another system outside of that?
I mean, it should be provided through the medical system, just like breast reductions quite often are, just like laser hair removal is in some places.
Well, breast reductions are usually cosmetic, but in some cases, due to other factors like breast cancer and such, it can then be lumped in with treatment. But because I had a family member who did that.
You can get a breast reduction here on the NHS just if your breasts are large enough that they cause you significant mental distress, right? You can get that done on the public healthcare system here.
Right. Can I ask a super quick question, just because I think this is what I think would help this conversation. I listened very carefully to everything you just said, and I don't understand where the disagreement in our positions are here, because I agree with you. People need to have access to all that care. I agree it's underfunded. Where, in your estimation, is the difference between your position and mine?
Well, on the first, it's the topic of the panel, right? Like, gender dysphoria as a medical diagnosis is currently a mental illness, right? And, like, a significant portion of the medical community have moved past that at this point. The ICD-11 already has removed gender dysphoria, right, and has added gender incongruence, but outside of the category for mental illnesses and so on. And so just the straight up pathologization of the condition of being trans as a mental illness. I mean, you've seen some of it in Wick's chat already. Trans people are just mentally ill and impressionable or whatever, right? The application of that reasoning is at the root of so much discrimination that trans people face in Western society.
And I hear that, and I genuinely appreciate what you're saying, and I think that's real, and it's got to feel really insulting, I would imagine. I do think that if you're talking about abolishing something like that, I think you've got to think really carefully about what's going to go in its place, because doctors do need to follow certain steps to make sure patients meet guidelines, right? If you want insurance to pay for this, at least in the United States, I think saying it's not a medical illness, I think they would love to not have to think about any of this stuff or deal with the political blowback of it, you know? Like here in Massachusetts, if you want FFS, you can get that for free if you have health insurance, right? Which most people do. So I think the downside of what you're talking about, and I agree with you, that's a legit issue. I think it's going to introduce a bigger problem, which is a massive barrier to healthcare access, at least here in the United States.
I don't think so. I think we can look at it as a disorder of sexual development and do the exact same thing, right? But it does seem to me that yours and Zonia's argument doesn't hinge on the question of the panel, which is it real, right? That doesn't seem to matter to either of you, at least in terms of the arguments that you've made so far, right? Maybe it does matter to you, but the arguments you've made so far have nothing to do with whether or not it's real. What you're arguing is that it's useful, right?
Yeah.
And that within, because of the way the current system works, that we need to pathologize trans people and say that they're mentally ill in order that they can get any healthcare at all. I think that is the argument that we need to that we shouldn't try and change that system. I think is a poor one.
I think that taking it and saying we need to pathologize trans people is incorrect. I think that's an incorrect position. Like, I think that what we need to do is effectively we need something to treat, right? So that's how Western medicine works. It treats maladies. The malady being gender dysphoria, which is a collection of symptoms. It's not about treating. It's not about treating trans people. It's about treating the gender dysphoria.
So why not a disorder of sex? I mean, also, I don't think a disorder of sexual development completely eradicates the problem of pathologization, but it would certainly be a step in the right direction. Why not a disorder of sexual development, such as in the ICD-11, rather than a mental illness, such as in the DSM-5 with the diagnosis of gender dysphoria? Why are we so attached to this particular diagnosis when obviously we know that the previous diagnoses were like transsexualism or gender identity disorder? Like, why is it now gender dysphoria? We've landed on this one, so let's keep this one now. Why can't we change it?
I don't think it's about that. I think it's about that we need something there to treat, right? And I think that's all that really matters. Whatever they call it or whatever they classify it as, or whatever correct category they slot it under, as opposed to a category error, I don't really care. Over time, we tend to learn that things that we categorized one way, later on we figure out, oh, we were incorrect about that. We recategorize them later, reclassify them, adjust them, tweak them. And that's happened with the treatment for what we currently call gender dysphoria. It's gone through several iterations as well.
So fundamentally, you're not disagreeing with me on the panel question. You're not saying to me, yes, gender dysphoria is 100% real. You're just saying we need some kind of diagnosis for Western medicine to treat, right? And I don't necessarily disagree with that.
Yeah, I'll 100% own that. I mean, I think one at
a time, gang. Go ahead.
Sorry.
Go ahead. Yeah.
Oh, you're both okay. Viv, finish your statement.
Whatever, Brianna,
go
for it.
So
Go for
Viv,
it. It's fine.
Wu.
What? No, Brianna, sorry.
Sure. I was just going to say, I 100%, I will completely own that. One of my limitations as a person is I am laser focused on policy and outcome. I'm a software engineer. I work on policy for a living. I'm 100% focused on that. Philosophy too, just to be really straight with you, I think she's a cool person. I like her, like as a person, I'd hang out with her. I can't watch her fucking channel because it's all this academic pie in the sky theoretical bullshit that I cannot connect with it as a human being. And I think that's where she really got into the mess with this, because I think the most charitable discussion of what she said is she is trying to think about like this as a philosophical question. And look, great question for an academic symposium. From my point of view, trans healthcare is holding on by a fucking thread in this country. In fact, I would say that trans healthcare in this country is actually the battle for fascism. That is the vector they are using to push some truly terrifying policies in across this country. And I think we're really going to have to push.
Scary looking in Kansas right now.
100%, 1000%. So I 100% agree with you that is gender dysphoria real? I don't know. I don't. I'm telling you, I'm not the person to have that discussion here. But I'm saying I think the trans community, very similar to the libertarian community, tends to sit down and think like, what is our ideal world that we would like to live in, right? If you talk to a libertarian, it's like, well, I don't think government should tax this, and I shouldn't have to get a driver's license, and I shouldn't have to do this. And that's great. Like, go over there and think about that dream world. I'm over here, like literally calling candidates for office on the phone saying, are you going to support this fucking bill? And I will give you volunteers and give you money if you give me the right answers. That's where I am. And I think respectfully, if we're going to push back on the fascism, I think we need a greater end of people thinking about this problem from a more policy-oriented position.
Okay, I'll let you respond to that, but after you respond to that, I have a question, because I may be the only one who actually doesn't know the answer here. But go ahead, Viv.
Made me forget my response. Look, I agree with you. The anti-gender movement is the vanguard of global fascism. I've said it a fucking million fucking times already, and I'm sure there's some people in the audience who are just going to be like, "Oh, Viv calls everything fascism or whatever," but like, at least you and I can fucking agree that it is, you know, the spear point, right? So I don't disagree that there are broader issues to discuss. I don't disagree that there are practicalities, right? And that you could possibly make a convincing argument that in some places in the United States, gender dysphoria diagnoses are a necessary evil, right? That they have to exist in order that something better can happen from them, i.e. trans people's access to healthcare. You can make that argument, that's fine, right? But it's still not the topic of the show. And I think that the idea that somebody who is engaged in philosophical discussions around gender and gender identity, for one, can't have these conversations, can't say these things in the public sphere, and is to be browbeaten if they decide to try and engage with the fact that although you think it is necessary, it is still evil, right? I don't think that's a problem. But also, I think that there are very successful examples of people arguing the depathologization movement, making arguments and that having positive effects. The depathologization movement has spoken at the UN, has helped inform human rights policy on trans people, right? You have in the United States informed consent clinics where people can go and access healthcare or trans healthcare on an informed consent basis, right? So there's also examples of it working like practically in practice that people can go and access. So I just don't accept. I don't accept, one, that it's a pie in the sky argument, and two, that even if it is a pie in the sky argument, that means people can't have those discussions in the public square.
I didn't say that.
So
okay, Zonia,
I want to.
I have a question, but go ahead, Zonia.
Yeah, so the issue that Abigail Thorne ran into is that now, even though she originally had her video from last year, which she talked in detail about her thoughts, and she prefaced it with, "These are just my opinions as a non-professional on this," right? But the problem is when she went to Twitter and put that out, it got caught on to because there wasn't all that qualification, there wasn't that prefacing, and she was making a pretty absolute statement. She didn't put it as, "I don't think it's this." She said that's because it doesn't exist and it was created by these individuals, etc. Right? So she made a much more absolute statement and put it out into the public, and that's where there's going to be a bunch of people like us, because we're going to look at her like an influencer that she is, and we're going to say, well, this is pretty irresponsible, this is incorrect, this isn't, the right kind of messaging, etc. And we're going to, and where Brianna Wu and I are going to align on things, we both see things in kind of a more pragmatist lens, like, okay, what is this message sending to people, and how is it going to be positive or negatively actionable toward our means, and the things that we're going for, right?
I want to step in here for a minute, because from my perspective as someone who is not trans, I am not trans. I knew a trans person in high school, but other than that, my only experience with trans individuals has come from online, right? If gender dysphoria is not real, if it was made up, if it was just created, right? And if being trans isn't a condition, and I'm not trying to be bigoted here. This is an honest question I have, please. If you don't need to treat it, right? Then what's the big deal? Like, if it's not a condition that requires treatment, then why? I mean, then it should be just cosmetic stuff. Like, what are we doing here? So, As I understood it, it was a necessary thing. Trans people need healthcare because without it, they're going to suffer, right?
Yeah.
Is that not? Is that
as we all do without healthcare, right? But like, the trans people do experience distress around their gender identity, right? And we already said, colloquially, that distress, especially since Blanchard basically invented the term gender dysphoria, has been termed gender dysphoria, and people use it in a colloquial sense in that fashion, right? I would argue that the medical diagnostic criteria do not describe something particular to trans people, and aren't particularly effective at describing trans people's experience either, right? But there absolutely is negative effects to trans people not receiving the healthcare that they need. We see that in study after study after study after study. That has nothing to do with whether or not the diagnostic criteria are good or whether pathologizing trans people in this fashion is good, right?
Because maybe I misunderstand what pathologize means then. Right? So maybe I misunderstand what that means, because I always thought that, like, again, as Zonia hinted at, that it was a medical condition that was in need of treatment. And that's a pathologization. Is that not correct?
So yes, to a certain extent, when we talk about the specific pathologization of people, we're talking about the pathologization of trans people for being trans and experiencing a lot of the same things that cis people do, but because they're trans, it's now a mental illness, right? And that opens up the pathways towards gatekeeping, things like conversion therapy, or saying, we should treat this psychologically instead of giving them the treatment that they need. And two is the impetus for a lot of the discrimination, both legal and social, towards trans people, saying, they have to have this treatment because they're mentally ill.
I think that, like, for example,
and if it's not accurate, right? Which, like, I don't think either of my opponents here in this discussion, I'm using that word very lightly, I think we're having a nice discussion right now, right?
Yeah.
But either of my opponents here in this discussion have managed to show that it is in fact real, right? It seems like they want to talk about a topic which is separate from the title of the panel, which is fine. Like, we can do that absolutely. But both of them seem to have at this point conceded that, like, gender dysphoria, like, they're not arguing that gender dysphoria is a perfect diagnosis, that it describes something real, but simply that it's the best tool that we have to describe the need for help.
Well, Wick, I think I can answer your question, but Zonia, you've talked less than me, and I want to give you a chance, so I'll shut up.
Everyone gets a chance. So Zonia, then Wu, go ahead.
So it's not about the pathologization, like, that's what the medical establishment deals with, is pathologies, right? And so they need something to treat. They can't just go and just out of nowhere just say, I'm going to do this thing for you just because you want it. So there's always has to be something there to treat. And that now what we're kind of conflating in this is that there's the pathologizing of trans people.
It's a hard word, isn't it? I keep trying to get my mouth around. It's just not fucking working tonight.
That there's the pathologizing of trans people, but that tends to manifest specifically more in, like, the social element of, like, everybody calling us mentally ill, calling us crazy, calling us delusional, right? And then tying that to, see, you have this mental illness, therefore. But the medical establishment generally, now there are biases in there, of course, but generally is not looking at it that way. They're looking at, okay, well, you've manifested these symptoms that currently today we have agreed to call gender dysphoria and classified as a mental disorder. And there's still variation in the pathologizing of that, because a mental disorder isn't necessarily a mental illness unless it is actually negatively affecting your life to the point of needing treatment, right? So that tends to be where they draw the line there medically.
This is where
hang on, hold on 1 second.
For me.
So
my audio's going out.
Sorry. No, we could still hear you. But I guess, like, this is where the
say that again. Sorry.
Can you hear me?
Mm-hmm. The audio went out for a few seconds. I've been having issues today with my audio.
Okay. So, well, this is where the disconnect comes in for me personally. Is
okay.
So, again, we've established that without treatment, they will suffer. It will be bad, right? Like, so I guess I understand your point about people using this to be bigoted. I get that. That happens. But that's a separate problem almost to me, right?
Well, it's a problem. It's a problem that exists because it is described as a mental disorder when it's not, right? Or at least I would argue it's not, right? Maybe
Is it not?
maybe the other people on the panel
Vic,
have a different idea.
Can I have a chance to swing at this?
Sure. There's been a lot of things said, but I'll try and keep them in my mind.
Yeah, just swing away. Give it a go.
Thank you. So Wick, I think this is a really important question, and let me repeat back to you what you asked, just to make really sure we're on the same page. So, what I'm hearing you say is, like, when we were growing up, if you knew a trans person, then you were told they need to medically transition to, like, alleviate the pain. That was your paradigm of it then. Yes. And it seems like you're hearing things today like, this isn't a healthcare issue. You don't necessarily need to transition. Not everyone gets XYZ surgery, right? It seems like people are talking about this more in terms of gender presentation, like socially, and you're wondering what you're wondering if there's something you're missing or what the trans community needs if it's changed. Yes, please.
Yeah, to clarify a little bit, like,
please.
When it comes to this topic, I'm talking in the case of medical treatment. So presentation, we could set that aside for now.
Sure.
That's not a concern. But if we were going to put someone
and why is the treatment necessary?
Yeah, if we're going to put someone on drugs or if we're going to do surgery to them, does that not indicate that there is something that needs to be fixed, a problem, right? Yeah. And I'm not saying that trans people are a problem. I'm saying that just like I had to have, like, this is a problem, right? My tooth issue, right? And I need medical assistance to fix it, but that doesn't make me a problem, right?
Right.
Yeah.
And so that's how I always thought about the trans condition.
I think that obviously there's going to be bad actors who are going to weaponize that against us, right? Yeah. It's doesn't mean that the doctors are saying that we're the problem.
Sure. I just want to give Brianna a chance to finish her.
No. I think that's such a good thought, and just speaking really honestly, it feels the trans community has unquestionably expanded since I was a teenager, right? And there's a growing number of people that are non-binary, right? Like, there's a very young trans girl I know here in Massachusetts. She's trying to get through it. And along with, like, wanting surgery and HRT and FFS, she also uses the pronoun they, which is just not something that really happened. I mean, Kate Bornstein did it a little bit in the 90s, but it's very much a new phenomenon. And I do think that the trans community I think it's expanded, and it's trying to wrestle with that exact question, Wick. And I think it's a very, very important one. Where the thing that gives me pause here, and I really want to stress here, I'm not trying to invalidate anyone's identity. Like, we have non-binary people at Rebellion, 100% respect it. I will, like, refer to you by any gender pronouns you feel suit you best, no problem. But what I hear on the policy side, over and over and over, state races, local races, I had with the school board this week, and especially at the national level, are Democrats asking the exact same question you are, Wick, and asking, why should we put all this political capital on the line for this issue if some in the community are telling us it's not important here? So this is why I would really, something I feel like the trans community needed yesterday was a true 50-state organization pushing civil rights, pushing messaging, and talking to legislators. Because I think the conversation that's happening on Twitter is not really advantageous when you're trying to talk to policymakers.
Yeah.
Vivian, if you wanted to take a swing at it as well, be my guest.
I don't really have a significant problem with what Brianna Wu just said.
You can call me Bree, by the way. You don't have to call me Brianna Wu every time.
Sorry, I just read the bottom of the panel because I forget who the fuck's even on the panel. I just read like Discord names, otherwise I just forget who the fuck I'm talking to. Fuck, and then I forget everything that I was going to say. No,
I can repeat it if you like.
So I think that most of what Bree said is fine. There was some stuff there that I'm sure we could get into about non-binary people and stuff, which just seems outside of the purview of this panel currently. But trans people do absolutely experience distress around their gender. Some trans people experience less than others. Some people don't require medical treatment, but for the ones that do, it can and often is life-saving, and being denied it can and often is life-destroying. Right.
So that's how is that?
There are like different levels of distress.
Sure, but I guess my question then would be, how is that not a mental issue? Right.
Right.
Well, when you say a mental issue, right, there's a difference between saying the condition of being trans is a mental illness, right, and saying the condition of being trans causes a certain amount of suffering that can manifest in comorbid mental disorders such as anxiety, depression, etc. Right? It's just the same as like having a facial deformity or fucking anything, right? Any of these things that can affect how you perceive your body, how other people perceive you, how you're treated in society. All of these things are not in and of themselves mental illnesses, right? But they can produce distress, and that distress can present as comorbid mental illness.
So, hold on. I wanted the thing you said there, like the condition of being trans. Like, it was speaking in a medical context. Nobody refers to like the condition of being trans. What they're treating is effectively the gender dysphoria, right?
I mean, it's essentially the argument about the pathologization of trans people is arguably that like doctors are not treating gender dysphoria, or they only identify gender dysphoria in trans people, right? Philosophy Tube made this argument in her video, and I think it's a very reasonable one, that there are a lot of things that are basically exactly the same that cisgendered people experience as well, but it's not termed gender dysphoria, even though it is distress relating to how their body is somehow incongruent with their gendered identity. Right.
So I think she's very wrong about that, though, because she kind of paints it as though because you're trans, you therefore then have gender dysphoria, is the way she's kind of painting it. And I don't think that's accurate. What's being treated as the gender dysphoria, not the trans person. And the gender dysphoria isn't something that's like applied to you because you're trans. You are trans because you have been identified to have these collective symptoms that we call gender dysphoria. So painting it the other way around, like you're trans and you're being treated because you're trans, doesn't make any sense at all.
I want to try to understand this.
So sort of to clarify or to wrap it up, the trans comes after the fact because you've been identified as having this, and then people refer to that as like gender affirming care, and then we have other classifications that we've used more broadly, which is like transgender is sort of the general grouping of all the people who have that. So that's
and a whole bunch of people who don't have that.
But you're not being treated because you're trans. You're being treated because you have gender dysphoria.
So is gender dysphoria?
I understand that.
I got a real question here. I'm confused. Zonia, please help me. So are you saying that the gender dysphoria is what makes you trans?
So that's in the medical establishment. Yes, that's the way it currently
I'm talking
works.
medically, like not socially, but medically. So do you agree with that? That's a question. Like, I understand that that's how it's done now, but
trans is just like a generalization, kind of grouping people together. That's not your designation. You don't go to it and we say, "I diagnose you with transgender." That doesn't exist. They're like, no, you seem to be exhibiting the manifestations of gender dysphoria, and so therefore we're going to give you gender affirming treatment or one of the whatever they have available. Right, so they're not diagnosing you with trans; they're diagnosing you with gender dysphoria.
Gender dysphoria is something that only trans people can get, according to the medical establishment, and that doesn't
no, they
seem
don't
to
care
make
about.
much sense.
No. The medical establishment doesn't care about trans.
Oh my fucking god!
Well, hold on. When I go to the doctors, they see me as they just say, you're a woman with, but then they'll say that I also have all the treatment necessary for like male physiology. So I have to do like prostate cancer checks periodically, right? But I also got to get breast cancer screening. So, but that's what they care about is like male, female, and like feminine needs, masculine needs, right?
I understand, Zonia, but
they don't call me trans. They don't classify me as trans.
Okay, fine. But if you were cisgendered, Zonia, would they diagnose you with gender dysphoria? If you had, for example, no breasts, or you had a masculine jawline,
they would. Yes, they would. Yes, they would. If you had, they would. If you had gender dysphoria, they would diagnose you.
One at a time.
Okay, hold on.
When has a cis person ever been diagnosed with gender dysphoria? When?
The person. So first of all, they diagnose you with gender dysphoria. It doesn't have to do with you being. You don't go to the doctor and say, "By the way, I'm trans." Okay, I dubbed thee gender dysphoric. That's not the way it works.
That's not what I'm saying, Zonia.
So
it's not what I'm saying.
What you're doing? Okay, no, I'm not. No, I'm not. Because stop for a second. Let me finish. Let me finish.
Okay, both of you stop.
What? You don't
get Zonia finish, and then Viv, if you have disagreements, you can. I will let you respond.
Okay, fine. But I wanted to address me.
It doesn't matter if there's no such thing as trans. It is you go in there and they say, okay, you have these symptoms and they seem like they're gender dysphoria. So we're diagnosing you with gender dysphoria. It doesn't matter if you're cis or trans because that doesn't exist in the medical system. The language trans and cis, these are not diagnostic terms that are used in the medical establishment.
Nobody's saying they are. Please stop saying that.
There's your answer. There's your answer then.
So okay. So the medical arena does not exist 100% independently of the social arena. Trans and cis are recognized categories in society, and doctors who look at people's symptoms, right, will not look at a cisgendered person and diagnose them with gender dysphoria, even if they're experiencing a lot of the same fucking symptoms.
No, they don't know they're cis yet. They don't know they're cis yet.
You gotta let Vivian.
But this is a straw man that she's doing now. They are not cis then. They are not cis then.
I'm reiterating my initial point. I can't possibly be straw manning because I'm not saying that you have a position.
Fine, go ahead and continue. It is effectively straw manning though because of what you're saying, what you're trying to put your position as against my position. So you're not being. It doesn't matter if you're cis or trans. You go there and you say, "I have these feelings, I have these experiences," and then doctor says you have gender dysphoria. It doesn't matter if you're cis or trans because it doesn't technically exist yet. Then they diagnose you with gender dysphoria, and then your choice at that point is whether or not you go in the direction of treatment that makes you transition. And therefore, at that point, you would be classified by the rest of society as trans.
So, I just refer back to the earlier one. When has a cis person ever been diagnosed with gender dysphoria? When has that happened?
You're asking a ridiculous question, and I think you understand this.
Yeah,
you literally told me that cisgendered people could be diagnosed with gender dysphoria.
Yes, and then if they pursue the treatment, and I stand by that. And then if they pursue the treatment, then technically they wouldn't be cis anymore. Correct?
No, if it's what? Okay. I think.
Am I the only one going crazy? Am I going crazy here? Does this make any sense?
I think I understand where the disconnect's coming in right now. Okay, right? When I tried to get you to imagine the hypothetical that you were born as a cis woman, right, and that you were presented to the doctor, right, with significant distress relating to your gender presentation because you had not developed breasts, you had perhaps a mannish jawline, a receding hairline, and people were perceiving you as masculine, right? If you present to the doctor in that fashion and you say, this is causing me significant distress because I am a woman, I feel like a woman, right? I want society to see me as a woman and I want to see a woman when I look in the mirror, right? This is exactly the same presentation as a trans person would fucking have, except you're cisgendered. The doctor would not diagnose you with gender dysphoria. They wouldn't because you're cis.
See what you're saying now. I see what you're saying.
You don't want to be a sex other than that which you were assigned at birth. You want to, but you're still experiencing all those symptoms of gender dysphoria, right? So effectively, the only people who can get a diagnosis of gender dysphoria are trans people, regardless of whether or not cisgendered people who don't want to move to a gender other than that they were assigned at birth, right?
Well,
regardless of whether or not they experience the exact same symptom.
Okay. So that has nothing to do with trans specifically. It has to do with whether or not the gender that you see yourself as aligns with what you were assigned at birth.
It's a very specific description of what pathologization of a specific group is, right? It's trying to explain
it's a specific manifestation. It's a specific manifestation, correct? So the difference there between the example you gave of a cis person having these symptoms versus somebody who's trans doesn't have to do with cis and trans. It has to do with what they feel. Is it in congruence with what they were assigned at birth or not? And so there's a designation for that called gender dysphoria when it is not.
No,
and
there's
that
a
is the thing
designation
that is
for that called trans. That's the social designation.
Well, we're not talking about that. You asked us to stick with the medical. We're sticking with the medical.
Right. Okay, so I have a question that
you're going to experience all those things.
I have a question that someone's paid me to ask, so I'm going to ask it. Okay.
Oh, good.
Right.
Get your bag.
Is it possible for someone to be seen as cis by society and then transition after talking to their doctor and determining they want to? Because everyone is cis socially, at least before they transition LMAO. That's what I was...
Can you repeat that question, please?
Sure. Is it possible for someone to be seen as cis by society and then transition after talking to their doctor and determining they want to, because everyone is cis socially, at least before they transition LMAO?
I think most trans people would feel and know they were trans inside before going and talking to the doctor. And if you're talking sticking to the pathology, like the WPATH standards, there would be a vetting process to make sure that you meet the criteria, talk through the feelings, explore options, look at socially transitioning first, do a whole host of things. So I think it's in philosophy tubes world, you would call it a category error because the outside world might see you as cis in that situation, but you would be trans actually.
Also,
essentially, the doctor is saying, by saying you have gender dysphoria, they're saying you are trans, right? Like, that's essentially what they're saying in the social context.
So, by the way, thank you, Viv, for your clarification. That made a lot more sense when you clarified.
I tried to earlier, but you know, never mind. It's all good. I'm glad we understand each other.
Yeah.
Okay, cool. I'm more confused than when we started this conversation. I'm going to be real with you, okay? I'm going to be real with you. I am more confused than when we started, and I want to try, for my edification, to get some clarification here and try to understand this better. Again, so initially, right, my understanding was someone, they know that, or they understand that there's an issue early. Like, they may not know what it is or what to call it, right? But they feel this gender dysphoria very early on, right? And this...
Some don't, but yeah, sure.
Fair enough.
It tends to have, like, for most people, it tends to have a curve over time, and more as you grow up and you start to experience your own bodily changes, then it becomes more significant and more substantial, and then you start really...
Manifests for a lot of people during puberty, yeah.
Okay. And then they seek treatment to get this done, right? I guess I'll just ask it. So even without any medical treatment, any medical or drugs or anything, no HRT, no surgery and things like that, we would still consider someone who's trans, right? Simply because they self-identify as trans. Is that something that we socially think is a good thing?
It's basically do you have the desire to be a gender other than that which you were assigned at birth? If yes, then trans. If no, then not. Right?
And
that's the very simple litmus test definition, whatever you want to call it.
Is that something we agree on here, or?
So, one thing I want to clarify, like, the identifying as trans is sort of like a thing. It's become a bit of a topic these days. It's like identifying as Viv put it, as a gender other than what you were assigned at birth, something that isn't in line with what you were assigned at birth.
Trying to
Self
avoid
ID.
the word identifying. I said, do you want to be? Yeah.
Yeah. So the question then comes down to, like, I don't know, like self ID is a big area of contention. The whole like wanting to be or choosing and such, that's something that's become pretty popular these days. There's a lot of talk around that, popular discourse around it. I tend to see it as I let people identify, like, I'm cool with people identifying as they want, to allow them more that liberty and freedom to experience their own gender and kind of better align with it over time and see what
but
works
they
for
have
them.
The same access that
But
someone who takes
access, I would say no. And I think that our advocacy in terms of on like a political level, legislatively, etc., should be narrowed down to those who really experience that strong gender incongruence that requires them to go through medical procedures and such, because those are the things that we need to prioritize. That's where we need to invest our energy, and that's where we're likely to get a lot of purchase with politicians and such, and leaders of various countries and such. So that's where I tend to move with that. Otherwise, socially, I can allow people to do whatever you want, whatever makes you feel good, but our priorities are not where that is. Our priorities are here, where we can actually make traction politically and legislatively.
Are y'all hearing a lot of static there, or is that just me?
I'm not hearing static.
Okay. I'm hearing static coming in from your audio just now.
Okay,
just started.
I will be back in 1 second.
We're all having audio issues.
Audio issues for the day. Yeah, I don't know. I think that it's just one, as someone who again doesn't suffer from gender dysphoria, it is interesting to me to watch this kind of play out, and it is hard. It's hard to decide, because again, one of the reasons I wanted to host this panel is because I want to support people that I can, but I'm getting mixed messages on the best way to do that from the community that wants me to support them. So.
Well, you do keep getting an awful lot of trans meds on your panels, Wick, so that's not surprising.
Can you define that for me?
Usually somebody who says that you have to have dysphoria to be trans, you want to have to go down particular medical pathways to be trans. They like to refer to certain trans people as like trans trenders, or like people who are not really trans, who are like bringing the rest of the movement down or whatever. They're the true transsexuals, all right? Everybody else is a fake trans. Yeah.
Okay.
Do you have a few of those?
Fair enough. But I guess to kind of steelman that a little bit, because again, I talk to them a lot.
Yeah.
If you aren't seeking like treatment for your condition, like, do you have that condition, or should you be treated as if you have that condition, right? Like,
well, one, there's a million different reasons why somebody might not seek treatment for a condition. Like, for example, I don't want to get it's quite personal shit to share, but I'll do it anyway. I don't want to get genital reconstructive surgery, right? I don't want to do it. Not because I don't think that like I would quite like something like that. It's because I don't think the technology is like 100% there for me to get something that I'd be satisfied with, for example. Right? There's a million different reasons why people might not access healthcare. But also, I refer you back to the definition of transgender that we said earlier, is, do you want to be a gender other than that which you were assigned at birth? And if we recognize that gender is, one, is a spectrum, two, is not entirely tied to biology, is connected, but is not defined by what your biological bits are, then that means that you don't necessarily have to undergo any kind of medical treatment in order to be considered trans. And I think
when we talk about this, I mean, like, when it comes to access to things like
access to healthcare. Well, if somebody doesn't want healthcare, why are they?
Not healthcare, but things like like if you were at a spa that had a women's section and a men's section, at what point do we allow someone who identifies as a woman to just go into the women's section, right? Do they have to do anything? I mean, I know it's a conservative talking point, right? But it is a question that I would have.
Yeah, now we're talking much sort of like broader social issues and stuff.
Yes.
And that the thing about trans people, what was it? Julia Serrano described herself as the thread that, when you pull, unravels the genders of everybody around her. Right? It was a very fun poem called "Cocky." You should look it up sometime. But like, the thing about trans people, queer people, homosexuals, right, is that when they crop up, they challenge a lot of the preconceptions we have about society. And so the conversations about them and what they're proposing and what their existence means for the current structures of society are going to encompass a fucking huge swath of what we currently think about the world, right? It's gonna have implications in terms of like how we think of ourselves as men and women, and whether or not these categories are even fucking valid or reasonable categories. I would contend that, like, broadly, they're kind of fucky, actually, and they seem to do a lot more harm than good, right? Especially in the instance of, like, the category of man, which seems to drive a whole bunch of people towards incredibly unhealthy behaviors for everybody around them, in the case of, like, propensity towards violence, sexual assault, and so on, and problematic for themselves, not seeking help for mental health issues, higher rates of drug addiction, homelessness, imprisonment, and so on. So, like, I understand that it's like really fucking confusing for somebody who's lived in a very sort of like black and white world where a lot of the questions have apparently been answered. But society does not work for a lot of people, and a lot of those questions need answering, because not only trans people, but cisgender people are being hurt in significant ways by our understanding of gender.
Okay, before we go too far, are we good,
I
Brianna?
think good. Can y'all hear me?
Yes.
Yeah.
Excellent. Sorry.
It's fine. We got it. We got it.
What drama did I miss? What did I miss?
Well, that was a lengthy one.
Zonia, go ahead. And hopefully this will catch you up, but we'll find out. If
yeah.
not, we'll find out. Go ahead, Zonia.
So I think like part of there's the social side of things, right? As Viv clarified, where there's sort of like this movement about pushing back against gendered and sex norms and such, and social norms in general, which is its own thing. And so overall, yeah, sure, there's a lot of like gender queer people and queer folk in general who are sort of pushing the boundaries of what society currently holds as what is acceptable or what is normative or what is non-deviant, and then everything outside of that is deviant. And so the queer community effectively is saying no, I think these things, like most of us have these things, but we tend to like keep them quiet and hide them because we think that they're embarrassing or wrong or deviant or whatever. And so we're out here loud and proud pushing those boundaries for you. Yeah. So there's that thing, and that's sort of its own thing. But when it comes down to advocacy for like medical treatment and stuff, you do have to narrow down the range of people that you're trying to focus on based on those who need that medical access and those who need that treatment. And so that creates a much more utility-based argument, right? And so, yeah, it's not as fluffy and as comfy as including everybody and accepting everybody. It's like, hey, everybody can be part of this little group here and expand it. It's unfortunate. Yeah, you do have to go and drill down on things that you would probably argue are trans medicalists. Mm-hmm. And that's not really a problem. That's just like, yeah, there are medical needs based on this very narrow subset of people. And so that's what we're pushing for. And because this is something that has a diagnostic criteria to it, it is something that we can then leverage very easily politically and lobbying wise in order to get legislators and country leaders and lawmakers to go and broaden the access enough to where there isn't too much gatekeeping so that those people can get much needed treatments.
Okay.
I'm not talking so long. Okay.
Yeah, you were going to say something before you dropped off.
Yeah.
I would love to be able to participate. So, Zonia, I really agree with what you just said. You and I are just about the same age, and something we saw through the 90s was the gay civil rights movement. They didn't sit there and like come up with a libertarian dream world of what they wanted to end queer oppression. They were serious motherfuckers that sat down and said, here's our list of stuff we're going to advocate for. I'll give you a really good example. Gay men, I believe even today, are prohibited from donating blood because of this fear of HIV that happened in the 80s, right? So when you're really trying to push forward gay rights, they weren't saying like, okay, we're going to have leather daddies walking down the street and we're going to really focus on this at the same time. They went through and professional groups like HRC made a list. And what made its way to the very, very top? It was gay marriage. And the selling message for gay marriage was very straightforward. It was love is love. And then you had Will and Grace, and you had a bunch of like easily understandable, relatable characters on TV. People started coming out of the closet. Ellen was on television. And suddenly, like, you felt like you knew gay people in your life, even in Mississippi. Like, my hairdresser came out at that time period, right? It was like, okay, I understand this. I think, for conservatives, there's like this argument like, well, it's just a free choice issue, right? And then for liberals, it's like, well, it's a human rights issue, right? And because they were very smart in how they prioritized that, and because they started to work at the state level on very specific legislation, you eventually got to 𝕵𝖎𝖎𝖙𝖘𝖍𝖔𝖜, right? So, none of this just happened serendipitously. It wasn't a bunch of people on a message board like dreaming about what they wanted. It was super tactical. And what I would argue for the trans community is someone who, as far as I can tell, I think we're one of the very few PACs out there that before we donate money to someone, we require the candidate to get on the phone and verbally like talk about their commitment to trans rights to me. Like, I do that every time before I write a check. I'm telling you, for people like me, it's easier if you have like a short list of things to push for, just strategically to push the movement forward. And for me, it's not them saying like non-binary and respecting non-binary people isn't real. I'm saying the easiest political sell that I have to ensure that like people have access to the public square is to treat this as a medical condition and to really keep the forefront on it as a healthcare issue. I think that would be very, very smart strategically.
Okay. So in terms of trans people accessing healthcare and the immediate practicality of the things that you have to deal with in your campaigning in your very specific area, right? Mm-hmm. I can understand that, and that is fine, right? But it's when you put these if you try and expand these prescriptions out to the wider community, I think it's just wrong. You said that the movement in the 1990s wasn't trying to parade leather daddies through the streets.
That's not what I said. That's not what I said.
It was in the advocacy specifically that she was talking about.
Right. Okay, so the political lobbying group and the people who are engaging with politicians directly in order to like fund their campaigns
on camera.
And stuff.
And on shows and talk shows and on camera, like doing
public
advocacy.
Again, that's not true, right? Because they had numerous different kinds of people on talk shows espousing all kinds of things. Some that I would say are absolutely fucking insane. Some that were utterly disgusting, like the PIE, right? Like it is absolutely not true that there is
advocacy.
What was a PIE?
No.
What?
The Pedophile Information Exchange. So we had some absolutely fucking disgusting and abhorrent things
people who are coming out speaking
to be part of the community. So no, there isn't this idea that like gay people were somehow this smart, unified movement that pushed only on practical, immediate politics.
And if you don't stop misconstruing what I'm saying, it's really going to damage our ability to have a positive conversation here. So I'm going to repeat what I said, and I would like for you to listen very carefully. What I said was when gay people were organizing and pushing for civil rights, they did not go through and push for everything at once. They had a list of things that made sense. A really good example, I said, was leather daddies parading through the streets. There was not a major legislative effort to make sure you could wear assless chaps out in public. Right?
No, there wasn't. Gay marriage. They just did it anyway. When they were organizing and pushing for civil rights.
Stop talking over everyone on this fucking panel. It is really obnoxious. Please.
I'll go just say from past experience with Viv, she's actually been really good about it this time around.
It's really frustrating.
If you're gonna say, the problem is, Brianna, right, is that I cannot allow when there are two of you that I'm talking to, I cannot allow you to gish gallop out a million points because I won't be able to address all of them, and you'll be able to get through some things which I think are contentious, right? And two, when you're patronizing and explaining and repeating things that you've already said, right, that I've objected to, and then you're just repeating them again, then it behooves me to point out that you're just saying the same fucking thing again that I've already contradicted.
Okay.
So when gay people were organizing, right, and pushing for civil rights, what was Pride? Was that not them organizing and pushing for civil rights?
I really want us to focus here. I do want to kind of establish a little more order in the proceedings. So I would ask that, yes, we allow people to get their points out, but I would also ask that we be more concise and maybe point by point. And then make a point, we address it, make another point, we address it. Is that equitable to all involved here? Can we proceed from that? And that, is that okay with you? We good?
I think it's reasonable to ask for clarifications and to bring you up on points that I disagree with, especially.
Yes, but we need to let the people finish the point before we ask for the clarification.
It can be difficult though when somebody goes on and kind of.
Well, I just thought we'd have a reasonable adult conversation rather than like I have my time, you have your time, blah blah blah. But sure.
Go ahead. Kick it back to you, Wu.
Finish what I was saying.
Yeah,
Thank you very much, Wick. So, Vivian, you're not going to like this, but I am going to repeat my point again, and I'd like you to try to hear the difference between what you're saying and what I'm saying. I'm obviously not suggesting that no one in the gay community advocated these things. Of course that happened. I lived it. Okay, I know that. I'm saying as a set of legislative priorities there. There was the most important to the least important. And they prioritized some things. And my meta point here, which I'm encouraging you to address, is that by making gay marriage the number one thing there, it was a very easy sell to a mass public. You even had, like in my home state of Mississippi, it was very easy to get conservatives on board with this because it was a freedom issue. So I'm just saying some strategic approach to how we talk about these things would be helpful. And one more quick point. I agree with you that trans Twitter is very frequently, unfortunately, put into the position of being the spokesperson for trans people. Yeah, I think it's very clearly been a disaster. I think trans people deserve a 50-state true organization pushing for their civil rights every single day, raising money, pushing back on these state bills, calling up state houses, all of that. And I think, unfortunately, because politicians are not interested in building something like that, it is defaulted to trans Twitter, which leads to some very garbled messaging.
Yeah, I agree. We need good, strong organizations with legislative priorities that provide immediate material benefits to the trans community. I don't disagree with that, and haven't at all on this panel. My objection is that we've moved, one, very, very far from the topic which we're discussing on the panel, but two, it also seems that even though we've moved very, very far, you seem to be using this prescription as a way to say that, like, other people discussing other things, having other priorities, having other ideas, even if they don't think they're above a great priority over like the immediate issues that you want to focus on, that this is like harmful and damaging and they should not do it. Right?
I didn't say that. I didn't.
Well,
I said the opposite.
I literally just said it seems to me that that's how this is going, right? Because otherwise, what are we having this panel about? Are we having this panel about is gender dysphoria real, or are we having this panel about is gender dysphoria the top legislative priority of of an organized trans lobby? Right? Like, these are two very, very different questions. And I'm trying to argue in favor of gender dysphoria not being real, while you're trying to argue something completely fucking different. And the only way that I can connect these is that it's what you said is not your position, right? The only way those two can be connected. It seems like we're having two completely different conversations.
So I thought we kind of clarified that early on and realized that we were deviating from the initial topic, which was, is gender dysphoria real, and moving it in the direction of, does gender dysphoria have utility in the medical realm in terms of treatment? So I thought we all agreed on that. That seemed pretty
I think
straightforward.
This might be my fault.
But then
but
then 𝕵𝖎𝖎 said, let's move it in a different direction, and then asked a question about whether or not people, like, self-ID was the way that it should be, and whether or not non-binary people should be represented in the trans community, and the conversation moved from there. So we're on a completely different topic now entirely as a result of 𝕵𝖎𝖎 over there.
I know.
Doing this to us, unfortunately.
You're allowed to do
but we went to self-ID, we went to social policy, and now we're on, like, what should be the top legislative priority.
Well, let's talk about it.
I'm fine talking about any of these topics.
Viv, I think this isn't as off topic as I think you're painting it out to be, because I think that when it comes to, like, how to change the medical healthcare for trans people, like what changes need to be done, because the whole point of the Philosophy Tube video was to indicate that there was a problem with how the NHS, the British healthcare system, dealt with trans care, right? There's a problem and it needed to be fixed. And within that discussion, she mentions gender dysphoria as being used by the NHS as a gatekeeping diagnostic tool is causing all these issues. So when we come to advocacy, which I think Brianna Wu cares about very, very much, advocacy for these things, we are looking at what is the best way to fix these problems that exist. And so I guess the question would be, is tackling the topic of gender dysphoria, whether it's real or not, is that going to be the best way to fix the problems? And if so, why? If not, why not? That's it.
Well, I mean, even in Philosophy Tube's video, right? Like, it's not it's one section of the video. There's a hell of a lot more that is talked about in that video. And I think it would be pedophogging to, like, fixate upon that and say that, like, this is the top priority. Because it's not. It was almost a side point. In fact, she said, we're firmly in the realms of my opinion here. I think she opened that segment with and said, you know, not all trans people would agree with what I'm saying, but blah 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 blah. This is my view of gender dysphoria and so on. Do I think that, like, trying to get rid of gender dysphoria from the NHS, right, as a diagnosis would be a good move? Yeah, I do, and I think that we can definitely discuss that. But, like, currently, the way that it works is that for almost every significant change that you want to do, you have to get this diagnosis, and it's a very difficult diagnosis to get for a lot of people. In the way that the NHS currently works, you guys work in America. I'm not 100% sure how the diagnosis works there, right? But you know, if we have to go in and get constantly asked about how we masturbate, and they will ask that to children too, which is super fucked up, right? If we have to go in and see multiple different people before being able to access any kind of healthcare, being put on multiple wait lists, this creates a bottleneck in the system, wherein a lot of people are left waiting for an extremely long time without any kind of healthcare whatsoever, and people die. People die on the waiting list for this treatment because the diagnosis is a requirement. My friends have died on the waiting list for this treatment because this diagnosis is a requirement for you to access treatment.
So I would argue that it's not so much the gender dysphoria that is, like, the classification that is the problem. It is the support for that treatment and that diagnosis, like having the doctors available, because it's specialty care, so it's a limited number of doctors who can actually provide that diagnosis. The bar to entry for the diagnosis is maybe possibly a little high. That could be argued down possibly, but most importantly is making sure that there are enough specialists that can provide that healthcare across all the regions that the NHS covers. But then in addition to that, that there is the funding necessary and the support network necessary to provide getting people to the point of having that diagnosis. That's what I would consider to be the issue, not so much the diagnosis itself.
But if the diagnosis is false and it doesn't properly describe an experience, then what is it useful for except getting a whole bunch of trans people to come into the system and, again, like Philosophy Tube says, lie to their doctors so that they can access healthcare? Functionally, does this not actually just operate on a not informed but a consent basis anyway? Because as long as you know the things that you have to say in order to get your treatment, that's what you'll do, right?
That seems like a lot of diagnosis in the medical industry.
Yeah.
So
Yeah.
I have friends who go and tell their doctors that they have specific conditions that they're suffering so that they can get access to benzos and stuff like that, right?
Ooh.
It's unfortunate. Yes, you can just go through sort of a checklist approach to going and telling your doctor effectively what you need, and it kind of sucks that that's sort of how the system has sort of been built up around lately. But most importantly is doctors need something to treat before they can treat you, and so we have a diagnostic criteria for that. Yes, it doesn't fully describe everybody's experience, but nothing truly does in the medical industry, right? So you kind of have to allow for these things to be a little bit,
so
generalizing.
If I could jump in here for just a second, I
gotta take a bio break. I'll be back.
Yeah, go for it. No, I think I think respectfully, and let me just preface this by saying I'm not an expert on your healthcare system other than hearing the horror stories that I hear coming out of the UK. Like, we joke and call it Turf Island here in the United States for a reason. It's really scary, and I really want to make it clear. I care about that. I care about you. These waiting lists are horrible. And I really wish I knew how to help, which I just can't do as a United States citizen. I do have to say that I think if you're talking about if the problem with the NHS is having this diagnosis of gender dysphoria, is this real? Is this not? Does this need to exist? It's like asking if Al-Qaeda uses too much oil in their hummus. Like, it's an interesting question, but it's not really the core problem, right? Like, the problem with the NHS is like Al-Qaeda, they're trying to kill people. NHS is underfunded. Right, you're under this tremendous political assault led by J.K. Rowling. Your institutions are falling back. Like, I saw stuff about the Gender Recognition Act and key figures like basically pulling out of this. Like, these are the major variables of the problem. Like, this theoretical question about gender I'm going to finish this problem about gender dysphoria being real or not. This is not the core problem. It's funding, it's waitlist, it's political will. It's the fact that your politicians are incentivized currently to go against trans rights because of your media system. Like, this is not the correct question to be asking in this moment, in my estimation.
Right, but it is the question that we're here to discuss, right? And regardless of whether it's the most important thing on the list, like, that's what we're here to talk about, so that's what I'm talking about. And I think there are some very good arguments for moving away from the diagnosis of gender dysphoria, and it seems like you don't want to talk about those because you think other priorities are more important. And
I mean, explain to me how it will work. Explain to me how this works. How do you see the pathway?
Here's a really easy one. A really easy one. Just move to the ICD-11 fucking diagnosis of gender incongruence and get rid of some of that pathologization of it being classified as a mental illness.
For clarification,
that would broadly have a
clarification for
positive effect.
For my education. What is the fundamental difference between the gender incongruence and gender dysphoria? Aren't they synonyms?
Well, one is classified as a mental illness. The other is classified as essentially a disorder of sexual development.
Okay. Can you explain
So,
to me
like,
why
I don't know
that's a helpful thing? Like, why is it helpful to transition from one to the other then? Like,
because of the rhetoric around trans people and the way that portraying them as mentally ill individuals directly harms their rights and social acceptance. So if it was simply classified as a disorder of sexual development, that would probably be a step in the right direction. It's not my ideal end point or utopian vision, as Brianna liked to say, but it would be a step in the right direction, away from classifying trans people as just being mentally ill because they are trans, right?
So, from what I understand of the ICD, and I could be wrong about this, and I'm kind of looking at it right now just to reconfirm what I'm thinking about it, but the ICD doesn't care whether something is a psychological malady or a physical malady. They care about classifying diseases in general. And it's up to the individual medical establishments in various countries and such to then for them to decide how it is that they categorize it. They may categorize it as a physical malady. They may categorize it as a psychological malady.
The ICD used to classify it as a mental disorder, and now it doesn't. They changed that in 2013.
So they did. Okay, so I wasn't aware of that. That's interesting. I mean, that could be something that like medical organizations and establishments across the world might want to adopt. But
okay, so
I didn't know that.
Wait, so they moved it from mental illness to this in 2013? Is that what you just said? Did I hear that correctly? Is that what she just said, that they moved it from mental illness to something else?
I'm sorry, I'm choking on my water.
Don't choke, don't die. If you die on my panel, I can't use this slide. So that would be very unfortunate. But no.
Well, all we'd see is the avatar going stiff. Fair still within TOS guidelines.
Sorry, I need to go and get some more water.
Okay,
right.
But for both of you, was that correct? Did I hear it correctly? That
I don't. That is what she said, but but I don't know that for certain.
If I could jump in, I was talking to Kyla about this. We did I think it was really one of the best panels I've ever done over on ContraPoints, basically looking at children transitioning. And we looked at a ton of studies and data before we started, and I looked at those standards. What I recall thinking with it is they were so much more non-specific in a way that it seemed to me like an insurance company would be much less able to deal with it. Additionally, like, I think it's important to remember, like, this diagnostic criteria is not the same as WPATH. The Benjamins were the very first like standards for people to transition that gave a pathway. They had the WPATH that came along and presented like an alternate path here. So I'm not a clinician. I can just say at my first glance of it, it seemed a lot more amorphous. I think there's a bigger question here, Zonia. I would love your opinion about this. It seems to me if someone's out there and, like, let's say they experienced gender dysphoria as a child, right? And they got access to care and they transitioned and then they were living in the role, like, successfully of what they identified with. They wouldn't have gender dysphoria at that point, right? Like, they were treated for something, they got health care for it, and now they wouldn't meet that criteria, right? So this is something typically
that's typically like the desired outcome, and some people achieve it, and some people have lingering, aspects of it for years.
Sure.
But yeah, typically that would be the direction that you would hope to go in, is treating, and then therefore having treated it,
alleviated.
Yeah, then it's alleviated.
Right, so I might have missed some of that. It sounded like you were saying it would be more difficult to get treatment for a disorder of sexual development than for a mental disorder. Did I miss here? Sorry, I was joking, so I could have done.
I just said the standards you're talking about seemed a lot less clear and more amorphous in a way that I think an insurance company here in the United States would look at it, and it would be difficult for them to check the boxes that, unfortunately, American healthcare requires you to check.
So they already do cover things like, for example, surgeries on intersex people, right?
Mm-hmm.
Another disorder of sexual development. I would argue that trans people are intersex, but that's a whole other fucking discussion. So disorders of sexual development are already covered by insurance companies. I don't see why it would be any different, but you know your insurance system better than mine. I don't think we can get away from the inescapable fact that essentially, if you think we should just stick with gender dysphoria, not move to something like the ICD-11's definition of gender incongruence or whatever, if you say a diagnosis is necessary and required for people to access healthcare in the United States, I understand that, right? I would describe it as a necessary evil. You might think it's just simply necessary. Doesn't really matter. But if you don't want to move away from the specific diagnosis of gender dysphoria, then it seems to me like you're saying, well, necessarily, we have to classify trans people, or at least trans people who want to access healthcare, as being mentally ill. And if you're not mentally ill, you don't get the healthcare. I think that that's a terrible way to treat an entire class of people as basically being like sick, diseased in some fashion because they're trans. Because
I get what you're saying.
Well, I got a question. Well, I want to ask a question about this. Like,
go ahead.
We would still be diseased, right? We would just be diseased with something else that wasn't necessarily mental.
Sure, yeah. Mental disorders have greater stigma than a lot of other kinds of conditions, apart from maybe things like sexually transmitted infections.
So can I ask,
sure.
Just for because I don't want to put words in your mouth, what is your issue with us being medically classified as mentally ill versus, or having a mental illness disease as opposed to a physical?
Sorry.
As opposed to a sexual development disease?
Because the medical leaks out into the social. The medical is what is like used in court cases and legislation and then on fucking Fox News, right? Like, consistently referring to trans people as mentally ill is incredibly damaging to the public's perception of us. It's incredibly stigmatizing. And if it isn't true, which I don't think anybody here has like argued that it is, if it isn't true, then that's fucking awful, right?
I hear you on that. Go ahead.
Well, I want to kind of follow up because I'll make it quick. So in that case, what you care about most of all isn't so much the classification as the way that society weaponizes that classification against us. And so you want to move it from a mental related disease to a sexual development related disease in order to take a weapon away from those who weaponize it against us. Is that correct?
I'm saying that's like one small step in the right direction. I already said that's not my ideal, but like, if we're just talking about like, should we keep the diagnosis of gender dysphoria? I think that that's probably one of the most convincing arguments. And like Brianna Wu keeps saying, like, the purpose that you two seem to have for this diagnosis is access to trans healthcare, and one of the most significant barriers to access to trans healthcare isn't like is social attitudes towards trans people and how politicians weaponize those in order to pass these fucking these awful laws, right? Mm-hmm. The interplay between the social and the political leaders. So absolutely, if we're trying to solve the problems that you see as existing and being solved potentially by gender dysphoria, I'm operating within your framework and saying I don't think this is helpful to your cause.
100%. And I genuinely hear you on that. I want to posit to you an opposite scenario. And Zonia, this is going to relate to one of your tweets here. I think you've outlined a persuasive argument about why this is bad. I would like to give you another argument to think about that I think has wider ramifications if you were to take this away. Zonia, you had a tweet that I saw that really struck me as probably being very prescient, that there was going to be a very high rate of cancer, estrogen-related cancer.
Estrogen-dependent cancer.
Cancer several years from now from people who spend a lot of time on Twitter and got the impression that HRT and a lot of these things are basically like taking Tic Tacs, right? It's harmless. You should have access to do it. Why go to the doctor? They're just gatekeepers, right? They're pathologizing you. They're holding you back. They don't have you in their best interest, right? So if you move away from making this a medical diagnosis here, I think I hear you when you say there's an abstract harm to the community of feeling like dehumanized in the rhetoric. I think that's fair. I think the flip side of that, though, is a really concrete harm that I think is happening on Twitter right now, which is people are being told that these drugs are benign, that oversight is not in their best interest, and they're just ordering it from wherever they want to online. And I think it's going to add up to some real world harm if we're constantly downplaying the benefit to a doctor overseeing these things is going to have.
Can I have consistently said,
go ahead, Zonia.
Well, no,
go ahead. Let
Viv respond, and then
I'm being rude. I'm sorry.
I have consistently said throughout this conversation that like medical oversight is a good thing, right? I mentioned about testing bloods, all that sort of stuff, right? That there should be medical oversight in taking basically any fucking drugs, frankly, right? So I'm not advocating for a complete free-for-all, just pop 'em like Tic Tacs approach. I'm advocating for informed consent with people who know what the fuck they're doing, monitoring your condition as you progress through your transition.
Okay,
that's what I'm advocating.
Good to hear.
Okay, Zonia, go ahead, and then I have another question. But yeah.
One of the things I've often thought about, and like I agree with Bree that Bree mentioned multiple times during this conversation that we need a strong representation that has that is a 50-state organization that can represent us, as well as in other countries they need strong representation as well. But one of the things I think would be, I don't know how feasible this is, but one of the things I've wanted to see for a long time are volunteer doctors working with NGOs that can provide that oversight and help people get access to these things, even in countries where it's not easily accessible, especially in countries where it's not easily accessible. I think that's really important, is getting those like volunteer doctors in these NGOs that can operate in this way, that can provide that screening, that insight, the measurements, etc., making sure that we don't have people that are getting too much estrogen and risking cancer, or people who are risking cardiovascular issues from the anti-androgens, etc. That would be awesome. I just don't know how feasible it is, but man, I would love to, if I could find a way to tap into that somehow and provide more support on that and get more attention on that kind of a solution, that would be awesome.
I know people that do that work, and I would love to introduce you. This is a Zoom call we should all have together. That is a really interesting idea.
Yeah.
Oh, great. I can't speak to that, right? But I can speak to a couple questions that I have, right? Well, Viv, if you want to respond, you may. I'll give you that grace first, and then I have a couple questions.
Sure thing.
Okay.
I don't have much to say on what Zonia said. That sounds like a pretty decent idea, honestly. You need people, especially for the people who are doing DIY HRT, who might be very skeptical of doctors, right? Or if they exist in a state where like that kind of healthcare isn't even available, then they need somewhere they can go to get their fucking blood work done, for starters.
Yeah. So is there the question then that I would ask to you first, Vivian, but everyone, I'm curious what they have to say. Is there ever a point, or under what conditions would you be okay with, or even advocate for, someone denying the access to HRT or surgery or other treatments, who says they really want one, or they really want this, right? They come in, they say, I want this. But is there any conditions under which the doctor should say no? Or do you think that the desire is enough to get access to these things?
Ooh, let me go first. So, there are some conditions. One of those my main issue with it would be when they're going to their doctors asking for those medications. That's where I would deny it. Like people who go to a doctor and ask them for a specific treatment or specific medications, I think that's a massive red flag. It's a big issue I have with like the marketing of medications to people. Ask your doctor about such and such, I think is a really bad thing in general. And we have that across the board with everything, including HRT. So yes, if somebody goes to a doctor specifically asking for HRT, I'd be like, nope. Okay, pumping the brakes on this. Hold on. Let's figure out what you actually have, or if you have something that we need to treat, and then go from there. But pump the brakes on it as soon as they're asking for a specific medication.
I think if my answer is very simple. I think if you can show that the person is either like not informed enough or is incapable of consent, then sure, you can deny them that. Otherwise, I think that like at least morally, it's a matter of personal autonomy.
Okay.
Yeah. Wick, before I answer this, I've got to do the politician thing and just say I think the major variable here is trans people not having access to healthcare. We're talking about an edge case here, and I just want to recognize that overwhelmingly the problem is with trans people not getting care. But you asked a valid question, and I want to answer it. I think that the reason that the WPATH currently has this 3-month talk to a therapist time limit here is there are some situations that could make you come in and think like gender dysphoria. I'm experiencing gender dysphoria, and maybe transitioning is the right thing for me to do. In the 90s, a really good example was sometimes gay men would experience a lot of structural homophobia, and they would think like, well, maybe if I just transition, this would get rid of this for me, right? You've got people that they've been sexually assaulted. And as a way to kind of get away from the trauma that they associate with the gender, there have been cases where they've wanted to transition, and a therapist just like put the brakes on and is ended up leading to a better outcome here. But I just cannot stress enough that is the edge case of an edge case, and overwhelmingly the problem is trans people not having access to healthcare.
Yeah,
these are extreme edge cases, and I just want to add that it's very difficult, actually, in the current political climate to talk about those edge cases because, especially, and I'm pretty sure you're going to start seeing this in the US soon because, Americans haven't really paid much attention to what's happened in the United Kingdom broadly, but a lot of what's happened in the United Kingdom, the rhetoric is copy-pasted over to the United States. The narrative of transing the gay away, that this is a homophobic eugenicist project of getting rid of gay people essentially by transitioning them a la Iran or whatever. That is a very popular narrative among like gender criticals here in the United Kingdom.
100%.
And that, like I said, the cases where somebody might decide that they want to try and transition because they're experiencing discrimination or homophobia, or to get away from the trauma of a sexual assault or whatever, are extreme edge cases.
Yep.
And there is absolutely no suggestion in what Brianna said that doctors would be pushing this as a way for them to deal with sexual trauma, or because the doctors themselves are homophobic and want to get rid of gay people. Yeah. I know you're not saying that, but I just think that
I think it's well
a good
said,
clarification.
And I really appreciate, because that is by no way my position. And unfortunately, you're dead on. That is starting to be more of the discussion here in the United States.
Yeah.
It's very, very unfortunate.
And it's always these extreme edge cases that are weaponized against us and used as a straw man against the rest of the community.
Salient exemplar. Yeah, it's always been a fucking thing for attacking minorities. Can I just... I guess one thing that I wanted to say attached to that, because I think I kind of got like... I do get pissed. You said earlier that you sympathise very greatly with our position here in the UK, and you wish there was something that you could do about it, and you don't know, what you could do from the US. The US Christian right, and even some of the non-Christian right, is fucking pouring money and activists into the UK, and has been doing since fucking 2016 in attacking trans people. They're now beginning to do it with abortion, right? Something we said would never fucking happen in this country, and something which you have experience of having said would never happen in the US. The push towards overturning abortion. So I would like, frankly, and I feel like there has been a dearth of this among Twitch streamers, among people, activists, etc., across the Anglophone world. There has been a dearth of solidarity in the direction from the United States to other nations. And the American evangelical right are extremely fucking good. I mean, look at the state of Uganda, right? They're extremely fucking good at doing this. And the progressives in the United States are very, very America-centric. And I think that not only would it benefit us to have that solidarity from you, and for you to like put a little bit more attention on it, it would also benefit you. Because as I explained earlier, those narratives, they move from we are the testing ground, right? They will take what they learn here and they will use it in the United States. And not only that, you're dealing with transnational organizations. The organizations that you're combating are operating in multiple countries. You know, I'm sure you saw some of the stuff about 𝕵𝖎𝖎𝖙𝖘𝖍𝖔𝖜 protests in New Zealand or whatever. That's American fucking CPAC and was it Hands Across the Aisle and forget the other one, whatever. That's those guys. And Wolf, fucking the Women's Liberation Front, which is a pretty solid TERF organization born out of a splinter group of a bizarre eco-fascist organization that exists in the United States that also does this all over the place, right? This is a transnational issue, so it requires transnational attention, especially from those people who are invested in it, right? It benefits both of us to do that.
I want to respect everyone's time here, right? I did slot you all for 2 hours, and we have reached that time. It has been a beautiful discussion. Better than I thought it would go, to be honest with you. And so I am glad that we had it. I confess, though. I don't know if... I'm still not sure if gender dysphoria is something that we need to... if it is something that is actually real. Like, if it's describing a real phenomenon correctly. And I wish we had gotten into that a little more. Because, again, I can understand wanting to classify it as not a mental illness, right? That's fair, for the reasons you mentioned. But if it is describing something that is real, then it's something that we should take into account when we are treating it.
I think we all on this panel here agree that gender dysphoria, as it's colloquially used, is just describing something real, and that as it's medically used, is attempting to describe something that is real, but I would argue that it is classifying it as something that it is not, which is a mental disorder specific to transgender people, right? And that would be where any kind of contention happens.
And with that, I want to just say, gang, tomorrow, 6 p.m. Eastern, so not 5 p.m. We're going back to my normal time at 6 p.m. Eastern. We're going to talk to 𝕵𝖎𝖎𝖙𝖘𝖍𝖔𝖜. We're going to be talking about sexuality and modern sexuality, the modern sexual liberation movement, things like that, and her views on the world. And yeah, we'll it should be a fun discussion. So if you want to tune in for that, it's going to be 6 p.m. Eastern tomorrow. We'll ask all sorts of things.
Are you going to take callers on that?
I want to, but I have to ask her permission first.
I have questions for Brittany.
I also have questions for Brittany.
Yes.
So,
wait, for who? Which Brittany is this?
𝕵𝖎𝖎𝖏𝖏.
The relationship and sex commentary kind of person, talks about bubbles and levels of people. Yeah.
Sorry, there's a lot of Brittany's on Twitter, and several of them are fucking.
There's only one Brittany
you can
Simon.
Blame it.
There's only one.
You can blame it on all the fans of Britney Spears who decided to name their daughters Brittany.
Well, hey, look at that! You named your daughter after essentially a music industry slave who was being horribly abused.
Wonderful.
I'm sure they'll love that.
Yeah, if you like what I do, sorry. If you like what I do, if you want to support this channel, because I need the support, gang. I need the money. I can't keep doing this for free, right? I got to pay my bills. I got to eat. So how can you support me? Well, you can super chat. And I love those. I love to read them. I thank you all for those. You can give me bits. You can give me subs. All this helps. The more I get, the more I can do. The more time out of my day I can take in order to put these panels together, have these discussions, bring people together and get them talking, right? Instead of just arguing and sniping at each other all day on Twitter, right? So thank you again, all of you, for being here. And I want to give all of you a chance to kind of shout yourselves out, tell people where they can find you, and have closing thoughts. And we're going to start with Brianna Wu. Go ahead.
Awesome. You can find me on Twitter, Brianna Wu. I'm very happy. We worked really hard on this Wisconsin election. We made over 50,000 calls and knocked on 2,000 doors in just one day this week, which we're very, very, very proud of, and helped win the SCOTUS race there, ensuring that women in Wisconsin are going to continue to have abortion access. Also worth saying, anti-trans propaganda played a major role in that race. I was very glad to outwork them on the ground and defeat that. Zonia, I just want to say, I don't know you well yet, but I've watched a lot of your work preparing for this panel. I really want to give you a genuine compliment. I love what you do. I think you're a really needed voice in this space, and I just I really hope you keep that up. Vivian, it's been great meeting you. Really appreciate that, and appreciate the civil discussion we've had today.
Thanks. Thanks for the. Okay. Cheers. Yeah. Thank you for the compliment.
We love Brianna Wu here. She's great. Again, give her a follow on Twitter, and listen to what she has to say. Next up, Vivian, the cat without a hat.
Hey, I'm not a cat, but but I am Vivian the Wolf on Twitch, Twitter, and YouTube. Mostly fucking Twitter at the moment. Frankly, I've been focusing on that for the last 6 months or something. I talk about anti-fascism, cults, and mostly TERFs at the moment. So if you're interested knowing the ins and outs of the gender critical movement, or you want to read through some boring fucking court case that I'm live tweeting or whatever, you feel free, send me a follow. That'd be cool. I like follows because I also like interviewing interesting people. And for some reason, people think that if you have a high follower account, they're more likely to talk to you than if you're not. And I really like talking to people that I respect and admire. So if you could follow me, that'd be great. That's all I ask for. Little follow on the Twitter before it all fucking explodes. Anyway, that would be grand.
Vivian, thank you for coming. Thank you for agreeing to have this discussion. I really appreciate you. So thank you for showing up. And thank you. And gang, give her a follow on Twitter. She's great. Thank you for keeping it relatively civil. Yeah, no, sorry. I should offer some thanks back in the other direction. I don't want to be an asshole. All right. Yeah, no, you guys kept it relatively calm and cool most of the time. I appreciate it. Cheers.
It was impressively civil. Thank you.
Yeah,
thank you for that.
Zonia, go ahead.
Hello. I'm not going to shout myself out. I'm cool. But thank you for having me on. Really appreciated the civil discussion. And it's rare that I make it to a panel these days. It was nice to be on a WhickTV panel.
Well, I'm glad that you decided to come on. We might have you on Friday. That's still kind of up in the air. I might have to push Friday back again, unfortunately, due to scheduling, but we'll see.
Okay.
I want to have it, but some real life things have come up, and I might have to read the only thing. But we'll
understand.
We'll see.
And thank you for the raid.
And we're about to.
Sorry, that was a shout. Never mind.
No, we're about to raid you too.
Okay.
Can someone explain to me what a raid is? I have always wanted to know this.
So it's a very simple procedure. Okay, when I'm done with my show, instead of just throwing my chat away to the ether, I bring them with me into another channel of my choice. And my choice today.
Oh, okay.
It's what chat over to another channel, basically. That's all it is.
It's what makes Twitch so incestuous.
True. And we're engaging. Well, no, I'm not going to say that. That's weird. But anyway,
echo chambers.
Yeah, but Zonia was kind enough to come on my show.
And out of control.
Zonia was kind enough to come on my show, and she is the only one of you streaming. So we're gonna go to her. Check me out tomorrow, gang.
Thank you.
Yeah, do it, and I braid you too, Zonia. So anyway,
thank you,
Zonia.
Bye. Not Zonia. Vivian.
Fucking.
I know, I'm a terrible person. Bye, everyone.
Wick, before you jump off, you have 5 seconds. Can we have a call after this?
Yeah. Let me read out.
Sounds good. Just